Hello guys and welcome back to ultrasound teaching videos with Dr. Arshad Nadimawan. Hope you are all okay. Hope you are all enjoying your life. Hope you are all practicing ultrasound and hope you are benefiting general community and your patients as well. Today my topic of discussion is spleen. As you know, for the last few weeks I'm discussing about the splenic pathology. In respect to spleen, I have discussed enlarged spleen, splenomegaly, and also I have discussed the differential diagnosis of the splenomegaly, which are very important. You should always put on your report and give direction to your GP or to your surgeon, so that he should get the clear advantage from your report. After that, I have also discussed the benign lesions. Many a time we come across with certain lesion on the spleen and we get confused. We simply write down that this is the lesion and this contain that much characteristic, it has that much characteristic, and at the end we forget to give the differential. So that's why I have also discussed the splenic nodules, splenic lesion, which happens to be benign. Today my topic of discussion is malignant splenic lesion. How it will appear on the ultrasound imaging, how we will differentiate it from one another, how we will write a conclusive report. So we are going to discuss this in this video. But before going to discuss, there is a list. You have to look for the list, how many types of malignancy we can appreciate on the splenic megaly, on the splenic imaging. And after that we will start watching the imaging, and on the ground of the images, on the basis of the images, you will be able to appreciate and differentiate between or among the different malignant potentials. So let's start watching these videos.
Malignant lesions of the spleen includes lymphoma, metastasis, angiosarcoma, and hemangiopericytoma. However, on the basis of the ultrasound, it is impossible to differentiate among all these four, and the appearances on the ultrasound happens to be quite confusing. So therefore, correlation with previous medical record is always recommended.
Splenic lymphoma. Splenic involvement during the lymphoma is very common, and it will be associated with general abdominal lymphadenopathy and certain constitutional symptoms. As you know that lymphoma is of two types, Hodgkin lymphoma and non-Hodgkin lymphoma. In Hodgkin lymphoma, it is said that histopathologically the involvement of the spleen is very rare. Quite often you will see that spleen will appears normal during the course of the disease, especially in Hodgkin lymphoma. But in non-Hodgkin lymphoma, there will be enlargement of the spleen, and you will might come across with enlarged spleen during the course of the disease. On the grounds of its clinical presentation and ultrasonography, it has four characteristics. It appears or it involves the spleen in four patterns. The first is a diffuse enlargement. There will be diffuse enlargement of the spleen, and you will see that that the spleen will be grossly enlarged. In a second category, there may be a small focal nodule less than 3 centimeter. This would be their second presentation. And the third presentation is likely to be more than 3 centimeter nodules. And in fourth presentation, there will be a bulky mass. The bulky mass will appear hypoequic, or sometime it will be hyperequic. If in case of liquefaction or internal necrosis, this will mimic as a abscess or as a cystic lesion. So but you should not confuse with the abscess, and you should have to look for the other features as well. So how it will appear on the ultrasound imaging, how we will appreciate all these four patterns on the images. Let's start watching these images, and you will be able to get all the information regarding the types of the lymphoma.
It is the slide of lymphoma, and you can appreciate enlarged spleen on the image. Multiple, rather numerous, tiny hypoequic nodules are scattered in the splenic parenchyma. This presentation is quite confusing with microabscesses, tuberculosis, and metastatic deposits. So the patient history will help you. Mention on the report enlarged spleen with multiple hypoequic nodules of variable sizes and gives you a differential including lymphoma. This is another lymphoma slide, and it shows scattered hypoequic nodules. As compared to previous slide, these nodules are comparatively enlarged and mimic as cystic nodules. In view, spleen is also enlarged. This presentation of lymphoma is also very common. Mention on the report that spleen is enlarged and multiple hypoequic nodules are seen. Give the measurement of only large nodule and at the end give your differentials. This is the slide of non-Hodgkin lymphoma, and you can appreciate spleen is mildly enlarged and an outpoaching is seen. It is bulky, heterogeneous, large, solid mass with central degenerative changes. As you know that lymphoma may appear as diffusely enlarged spleen or micronodule less than 3 cm in size, or macronodule if the nodules are more than 3 cm in size, and sometime in fourth stage it appear as a bulky nodule or bulky mass. So this presentation shows bulky mass arising from its upper pole. Write down the characteristic of the nodule and give your differential and recommend further radiological imaging for confirmation. This slide is of B cell lymphoma. On this image, spleen is enlarged and its parenchyma is heterogeneous. An ill-defined mass lesion is protruding out from the mid-zone of the spleen. It looks as this lesion is setting pericapsular. Margins of the spleen are also irregular. Mention on the report all the sonographic characteristics, give the size of ill-defined lesion, and in the conclusion give your differential and advise correlation with previous medical record and further imaging for the confirmation.
With respect to splenic malignancies, there are certain other malignancies. It could be primary malignancy, especially angiosarcoma and hemangiopericytoma. These two likely involve splenic parenchyma. But metastatic deposit, it could be definitely there would be some primary malignancies elsewhere, and it likely to involve the splenic region. But before involvement of the spleen, you will see metastatic deposits in the peritoneal cavity, especially in the liver parenchyma. So after that, there would be a chance to involvement of the spleen in later disease processes. So how these three malignancies will appear on the ultrasound imaging, how you will appreciate all that, and how you will differentiate these from one another. So let's start watching these images, and hopefully you will be able to differentiate all these three malignancies within the splenic parenchyma.
On this ultrasound image, you can see that spleen is enlarged and its parenchyma is interrupted by numerous hypoequic tiny lesions. Largest one is measuring so and so. So when you are writing the report, you must mention that spleen is enlarged in size and its parenchyma is interrupted by multiple hypoequic tiny nodules. Largest one is measuring so and so. Always mention the largest nodule. You don't need to mention all of these. You don't need to take the measurement of all these nodules. It's impossible, and do not confuse the clinician. So therefore just give the largest nodule size, and at the end especially give your conclusion, because this presentation usually confuses you with metastatic deposits, with lymphoma, with candidiasis, abscesses as well. So therefore include all these differentials on your report, that differentials include lymphoma, metastatic deposits and candidiasis, and correlation with further clinical record, previous clinical record and other imaging is recommended. Have a look. This slide show metastatic deposits from malignant melanoma. Here on this image you can appreciate multiple target lesions. These black arrows indicating target lesions, or you can also use the word bull eye sign. Centrally these lesions become hyperequic and it is surrounding by hypoequic halo. Again, this is another confusing lesion, like you have to give your differential. Mention on your report that liver parenchyma is interrupted by multiple, rather numerous target lesions or lesion with bull eye sign, and the differentials include malignant metastatic deposits, or it might be abscesses or maybe lymphoma. So always give your differential. Beside this, write down that further correlation with previous record is recommended. This image shows solitary lesion, hyperequic lesion, and if you focus on, so you can see centrally hypoequic areas which may likely be degenerative changes. Spleen is enlarged, and otherwise the area of the spleens appear normal apart from this solitary lesion. The solitary lesion is echogenic with central cystic degenerative changes. So this is another example of colonic cancer metastasis. So mets can be in, usually it appears in numerous form or multiple form, but it may likely appear in singular form or in solitary form. Appearance of this lesion usually confusing with hemangioma, but it is not hemangioma. You can mention in your differential giant hemangioma as well, but you have to mention other differentials and likely differentials if you have relevant history and previous investigation of the patients with you. As the previous slide was a bit confusing, and it was showing a characteristic of both benign and malignant lesions like hemangioma and also metastatic deposits, so that's why CT scan was advised. On the CT scan here you can see liver is enlarged and there is a multiple hypodense lesion within the liver parenchyma. Also spleen is enlarged and the splenic lower lobe shows hypodense lesion as well. So on the basis of these CT images and further investigations and biopsies, it was confirmed that this case was colonic cancer. So this CT scan shows also metastatic deposits.
Yes, friend, this was all regarding malignant nodules of the spleen, and we have discussed at length about the lymphoma, angiosarcoma, hemangiopericytoma, and metastatic deposits. On the ultrasonography, it is not quite difficult. You can easily appreciate and pick all these characteristics. But if you have any history available with you, this would be easy for you to diagnose and directly jump to the diagnosis. But before going to directly jump into the diagnosis, always try to give your differential, because this is very important. Sometimes these pictures are very confusing and you will not be able to reliably diagnose all these malignant lesions in the spleen on the ultrasonography. So this was all about that malignant diseases and malignant tumor of the spleen. Stay in touch with me, keep watching my videos. We will see in the next video, and hopefully this will benefit you regarding in your clinical practice. So take great care of yourself. See you in the next videos. Till then, bye bye.